Good morning, ma'am. Please allow me to introduce myself. I'm Silvestre, BSN2-1, and I'm student nurse from Islam University, Philippines. So this return demonstration will be sanctioning a newborn using Bob syringe. But before that, we will have the purpose, assessment, planning, and of course the procedure. For the purpose, it is to remove the visible mucus secretion and vomitus from the newborn's mouth or nares. For the assessment, we have to assess for the following. First, we have to inspect the mouth and nose for visible secretion or vomitus. Second, we have to auscultate the newborn's lungs to evaluate for evidence of crackles and wheezes. Third, the functioning curve and Bob's syringe. And fourth and at last will be checked for ear drop. Now we will move on to the planning. We have to gather and prepare the needed materials or the necessary materials. So we have the hypo tray that behind me, warm blanket, clean bomb syringe. We have the mask and pair of sterile gloves, receptacle, and right after, we have to do hand washing and wear the sterile gloves. And of course, the mask. Now we have the procedure. As soon as the infant's head is born, sanction mucus from the mouth. The first thing that we need is to compress the bulb before insertion to prevent injury to the newborn oral mucosa. As we compress it, so just like this. Okay, then right after, we have to gently insert the tip of the bulb syringe into the dependent side of the newborn's mouth to collect the drainage. And then we have to execute our hand in the like this, like see, into the newborn's mouth and gently insert the syringe valve or the valve syringe. Next is to release the compression on the valve to allow for expansion and the collection of secretion. Release. That is to prevent aspiration of secretion. Next, we have to remove the bulb or the bulb syringe from the newborn's mouth and gently squeeze the bulb to release the collected drainage into the appropriate receptacle onto a tissue. Release. And then we have a tissue. Next, we have, as soon as the infant's body is born, we have to hold the infant with a head slightly defended. So just like this. Hold the infant slightly dependent, just like this. Okay? And then, after that, we have to keep the infant warm by drying and providing the radiant heat. And then we have to repeat the step to sanction the other side of the newborn's mouth if necessary. Repeat the step to sanction each nares. So each nares is like this one, okay? Or the nostril of the newborn. Then right after, we have to discard the collected secretion properly and clean the receptacle. So as we discard and clean, now we have to wash the bomb syringe in a warm soapy water and rinse and dry. So as we rinse and dry, just like rinse and dry, place the bulb syringe back in the newborn's bassinet for future use. And then we have to remove the gloves, discard properly, and wash our hands. As we all know, that is to prevent spread of microorganism as well as to protect the nurse and the client by reducing the transmission of the bacteria and the microorganism. Now we have to assess the newborn's lungs, that is to provide reassurance and comforting to the parents and the newborn. That is to check if there is no secretion left to be sanctioned and provides additional data on the newborns. Always remember to document the procedure on the newborn's chart. Timely documentation helps to ensure the patient's safety. And remember, it is to provide the record of the patient or our client care and serves as the baseline for further management. Thank you.